So this is the second video in the series on Trichotillomania overview. This one will focus on our goal in cognitive therapy. So as I mentioned in the first video, one of the causes of trichotillomania is the creation of additional or unnecessary or extensive stress via negative thinking styles. So as we know, when a person tends to be very judgmental or critical or negative, or has anxious thoughts and identifies with those thoughts, this triggers the emotional system and creates unneeded and unnecessary stress. So in the cognitive part of therapy, a big focus of ours is to help them adopt healthier cognitive habits and styles in order not to create that unnecessary stress. So we'll help them identify those habits, we'll give them exercises to challenge those habits, to adopt healthier habits, positive thinking, thoughts that increase self-esteem, challenging or diminishing or postponing thoughts that create tension. These are all common techniques in CBT, and by giving these to patients who suffer from trichotillomania and dermatillomania and tics and nail biting, we actually assist them in creating less tension, which then builds up in the body and then seeks a release via these compulsive behaviors. So that's our goal in cognitive therapy. Obviously, if there's any negative thoughts or judgment or criticism regarding the behavior itself of pulling hair, or shame, or self-criticizing, we really want to focus on those, because if they engage in those types of thinking styles, then they're creating a negative loop, a negative cycle where they create tension and then they feel the impulse to pull hairs, then they do that, and then they criticize themselves for pulling the hairs and then create more tension and more impulse to pull. So we really want to review all these different kinds of thinking habits. And that's our primary goal in the cognitive aspect in the cognitive therapy for trichotillomania. And in the next video, I'll go over briefly on our goal in behavioral therapy for trichotillomania. So see you there.